Here we go.
Okay, so good evening and welcome to our latest Hacking Health Waterloo Cafe. Thank you for joining. My name is John Gregory and I'm one of the co-leaders of this Hacking Health Waterloo chapter, together with Drew MacDonald, who's put tonight's agenda together. We invite you to tweet away at Hacking Health Waterloo, Waterloo, at Waterloo EDC, or at MedInnovX for Medical Innovation Xchange. So Hacking Health is a volunteer international grassroots network, started in 2012 in Montreal and has grown chapters around the world, running more than 160 hackathons locally in the Waterloo region. We aim to act as a little of a connector in what is new in health and tech. Now, it's been my view for a long time that we need a Waterloo regional health innovation plan. And I really do feel that the Waterloo Health Innovation Ecosystem map and the establishment of MIX mark poignant steps towards that. Waterloo's health innovation ecosystem features 100+ companies, including exciting startups and scale-ups like Intelligent Surgical, KA Imaging, as well as others, global leaders in health innovation like Agfa and Siemens Healthcare. The Waterloo Health Innovation Ecosystem map provides a complete business listing and information about the region's health innovation research and commercialization organizations. Its launch further solidifies the Waterloo region in one of the world stage, and it's a superb initiative. And we are so honored to have some of those who contributed to its development. They are, Catharine Gerhard is Market Manager for Waterloo Economic Development Corporation, is that right? Where she is responsible for attracting investment from the Eastern US to Waterloo region. Catharine also supports the growth and expansion of local tech, health innovation, and finance service companies in the Waterloo region. Catharine has been in the industry for 20+ years and Waterloo region since 2006. And notable careers successes include attracting EPAM, S-Script, which is a Bosch company, to the community and helping companies like Novacol, Point Click Care, and Huron Digital Pathology continue to grow in Waterloo region. She's been massive growth in the economic landscape in the Waterloo region, and she's proud to call it home with her family. In her personal time, Catharine is a producer and co-host of Live Wild Radio. You need to learn more about that. And you can find her working out, mountain biking, rock climbing, or backpacking. So also with Catharine, now Elliot Fung doesn't want you to innovate, he wants you to disrupt. So Elliot has a long history working in the domestic medical technology industry. In January 2021, so not that long ago, he joined the Medical Innovation Xchange, MIX, as we know it, as Executive Director. Prior to joining MIX, Elliot was VP Innovation and Strategic Partnerships at Ontario Health, which is where many of us know him, where he was already a passionate supporter of the local ecosystem. Prior to that, Elliot also worked at BlackBerry, where he supported large enterprise customers launch and scale new products. He has held senior positions in public affairs and has served the community as a municipal councillor in the township of Wilnot and as vice chair of the Waterloo Region District School Board. Thank you. We're delighted that you are here. As always, we encourage you to submit questions through the chat pane in Zoom, which you're now very familiar with. We will monitor the chat. So maybe first of all, I hand off to Catharine.
I'm operating two computers here. Anyway, my printer died. Anyways, really nice to meet you all, and thanks for having me. Happy sunny June day. I hope the weather's awesome. All right, so yeah, it's a pleasure to be here and share with you the background of this Health Innovation Ecosystem map and just some of the observations I have made along the way. My objective today is to talk about that, tour you through a little bit of our ecosystem, and let you know how we can help you grow, because our mandate is to attract companies to the region, not only in health innovation, but in tech, manufacturing, business, financial services. These are the areas that we're strong in, but also to help our local companies grow and scale. So, so, these sector ecosystem maps are actually one of our most popular tools. So we have an amazing marketing team that produces a lot, but it is the cluster maps that hands down are the most downloadable tool. So it's great for this region, it's great for you. We know that companies, it's helped us highlight companies here to make connections and business transactions have occurred. And actually with health innovation, it's not just within its own cluster, but it actually transcends or crosses over to auto tech. We've had requests from automotive manufacturers looking for health innovation. We've had requests from financial services. And then robotics and automation, everybody knows ATS is here. We have a huge robotics automation cluster, and a large portion of them are playing in this field as well. So I think more and more we're seeing the interest by these other sectors to connect with you. So this is kind of neat. So I'm going to launch into just a couple slides and walk through how it all came about. And let me just switch computers here. Okay, can I share screen? Do I have permission to do that?
Yes, you do. Yeah.
Wonderful. Okay, so let me get this loaded. Just a second here.
There, we can see that fine.
Oh no, I just lost it. Hang on. Are you seeing my presentation right now in the back view?
Yeah.
Okay,
yeah.
So now let me just move this out of the way. There we go. So there she goes. Okay, are we good?
Yeah, perfect.
Wonderful.
Nice.
Okay. All right. Come on. All right, here it is. And I want to make sure that you're not seeing everybody else's faces right now, are you? Like, that's what I see. There we go. I'll get rid of that. There we go. Just to make it a little easier to see in case. All right.
Okay. Yeah. Everybody can individually turn those off, just so everyone knows.
Awesome. So this is it. So this was in the making. This took about 4 months. We completed it in the fall of last year. And so our role with this sector is, again, to promote this area. And our interest in doing this was as a promotional tool. Number one, to understand what do we have in our community, because it had been quite a while since we last took an inventory. And I'm talking like 2008. I was actually part of the former organization, and I had worked on that a little bit. But we really wanted to understand what was here, and then to promote our strengths. And so this was, out of all of our cluster maps, by far the most focused, working with our stakeholders. And in fact, so we hired a consultant, 10 Consulting, and they brought on, we were very lucky to have Elliot and IntelliJoint be a part of it as far as advising, the process. But we also connected with local stakeholders. So when you see this map, it's very much based on partnership with local stakeholders like Communitech, Waterloo MedTech, Velocity, Accelerator Center, the University of Waterloo, Conestoga College, et cetera. So we reached out to everybody to get their feedback. And when we wanted to get their feedback, but we also wanted to help us identify companies. So the first part of this, or let me just step back and say, okay, so we've got about 113 companies here. This does not represent everybody in our community, because to be on this, we had to get permission and by the company, use their logo, but also identify which category they fell under. So in fact, there's probably we identified and we vetted a list, probably about 170 total in the community. So you're missing about 50. That aren't here. And so that's number one. When we took a look at defining the sector, we looked at globally, how is the sector, life and health sciences defined, right? We looked at the US, we looked globally, and then we also spoke to Life Sciences Ontario in addition to our local ecosystem. And so, as you can imagine, and a lot of people already guessed, this is going to be a heavy med tech ecosystem that's here. And it's very much the case. And we actually broke it out into digital health. We had the imaging hardware and software, instrument devices, and medical equipment that we thought made up the medtech, but we want to, zone in and into that and flesh it out further. But what we also included was contract manufacturing, because, interestingly enough, companies like ATS, they're global giants. They're a couple thousand, I think about 3,000 people. Locally, or this company, 40% of their business is in life sciences. So they're actually a major employer. They're the dominant employer out of anybody else here. So it's not what comes to mind, but it's a fact. And then there are others in that category as well that play in this space. And this is before COVID, by the way, okay, just to make a footnote. So hang on a second here. Right, so when we did this exercise, we wanted to cast a very wide net. In addition to what you see here, we also targeted agrobiotech companies, veterinary medicine, B2B, and contract research. But we didn't include them in the end because there really wasn't any companies that, there wasn't enough of a category or a cluster to put it on the map. And by the way, when we reached out to companies, we had them select 3 categories. So what you see now is their priority category, which they belong to. Okay, so it is true that many of them do, operate in other areas, identify with these other categories. I also wanted to note that we did not include environmental services. There's a big industry here in that area. It's more on the remediation side. It is part of life sciences in a way, but we are actually, another community partner, Sustainable Waterloo Region, is doing a clean economy or clean tech cluster map. So we knew that was going to happen and we want to separate the two. The other thing that this does not include is agri-food. Because as you know, with the University of Guelph nearby, and this is a big strength of theirs, there are companies here that operate in this space with animals and food. So again, we thought that deserved its own cluster map. So as a caveat, these are the 2 sectors or other types of, they're often seen in part of life and health sciences are not included here. And then finally, with COVID, you've just seen a massive uptick of companies getting to PPE. They are not in here. There are others in the community that are tracking that, like medtech, for example. But as far as a company that started PPE as a result of COVID and they pivoted, they're not here. But if they were doing it beforehand, like O2 Industries, right, the mask, they're here because they've always been doing it and they're committed to that. As you understand, like Linamar, for example, they pivoted in this area, and of course they're not here in this region, but any big companies that got into it as a pivot are not here. So that's just a bit of a caveat for So aside from contract manufacturing, one of our partners said, you should really put in AI and machine learning. And we saw that there was, in fact, a lot of companies that identified with that. So for us, that made sense to include it as well. It wasn't what we initially thought would be a part of this health innovation map, but it is a strength. And they truly are focused on just AI technology, not that AI is a part of their technology, it is the product, okay? So, so that was interesting. So very much, as a lot of people predicted, this is a very heavy medtech community. And that represents about 68% of the companies here. And then 12% equally divided for contracts, manufacturing and biotech and pharmaceuticals, right? So those are the next bigger categories that you see in this community. And then the AI and machine learning and laboratory services are the smaller piece to this pie or to this complete picture. The other thing to note is that you have a majority of companies here that are startups. So in 2008, I had inventoried this sector. It was a part of an initiative with the University of Waterloo, Conestoga Laurier, and City of Kitchener to determine, is there enough of a life sciences commercialization sector here to warrant a life sciences incubator space, okay? And at that time, there were half the number of companies that we see today. And so you see that growth, especially in the startups that have become very successful, like IntelliJoint, for example. And there are others that continue to grow. And so Siemens, for example, they acquired Medicalis. Siemens Healthineers is here. So, the startups here have attracted a lot of other industry, but they've scaled and they've held their own. And of course, Elliot's going to talk about Mix, what they can do to help our startups and our startup community continue to grow and thrive. But, of course, there are some really big companies here as well. And I think a lot of people look to ATS AGFA, they've been here for quite a few years in imaging. You have Unitron, it's a lot of medical device or instrument companies, hearing device companies, sorry. Unitron, Bernafon, Sonova opened up an innovation lab recently. Primed came from Calgary in the past year to actually do some PPE expansion here. And then you have companies like Google. Google has Google Health, I've understood. And then of course, the recent announcement by their sister company, Verily, they're setting up an R&D center. Perkin-Elmer, we've worked with them. They're from Boston. Point Click Care out of Toronto. They have a center of excellence here. Health Hub out of Toronto as well. LabSat has their headquarters here. That actually was a surprise to me. They have about 400 people in this community. But the Siemens Healthineers is kind of neat because it's their global, they have their global R&D for imaging research here in this region. So, which is also interesting because I've been talking to other companies in this community who work with them. And I'm like, oh, by the way, did you know that they're here? And they didn't know that. So, which is why I'm really grateful to have this opportunity to talk to you today, because we find that a lot of people don't know who's in their backyard. And they, or even what the partners are doing. And it's because your head's down and you're focused on what you should be doing and it's your business. So that's been really eye-opening to see that, a lot of our companies could really use that support. So how do we help companies? I'm just gonna, here we go. Oh, sorry. Actually, before I move on. So commercialization hubs, so the first piece were the companies. The second piece were the hubs and research centers here. And I've already mentioned Mix, and I'm sure Elliot will talk a little bit more about that. But there's also Waterloo MedTech. They do an annual conference, and they're based out of the Data Hub. You've got Velocity and Accelerator Center, each in their own right, producing some pretty top, interesting companies that are scaling. Out of those two incubators and accelerators, the Founder Institute, certainly JEDI, which is the gateway for industry working with the University of Waterloo. They play a part in helping innovation. Google for Startups, again, their accelerator for startups in all of Canada was in Waterloo, like the same thing for their Google for Entrepreneurs, the first in all of Canada was in Waterloo. So there's a lot going on here to help companies. The Data Hub, really relevant. I find that when I talk to companies, AI is always a component of what they're doing. There's always some connection. So nice to know that these other resources are here aside from Communitech. Catalyst, it's the largest IoT hub actually in North America and Europe, being at 500,000 square feet. And this is all privately run by Curtis McBride of Myovision and a few others. But this is an interesting space just close to Communitech, and that is encouraging co-working space and private space, but a different kind of community for hardware and IoT. And then of course you have the Research and Technology Park across the University of Waterloo, having that proximity, and through the Accelerator Center. There's a couple different locations that it's very easy for companies to soft land in. In terms of research labs and hubs, the key ones that I want to talk about are the AI Institute, the Center for Bioengineering and Biotech. Then you have the School of Pharmacy and the Institute for Nanotechnology. Those are the big ones that are really relevant. I guess it depends on who you talk to, but that are really popular amongst companies. Another one I will give a shout out to is the Center for Ocular Research and Education. And I mentioned that one because it's leading worldwide. It ties head to head with another institute in Australia. But there's some pretty fascinating things going on there and quite an available pool of talent. We all know that software engineers at the University of Waterloo are highly sought after. We're finding that the talent at the University of Waterloo for life sciences is not there's always room to hire. There's always capacity. So good news for us, but an opportunity for them to connect with the ecosystem. Just giving you a little bit more information if you haven't already heard, but I'm sure you have. The University of Waterloo has decided to put a flag in life sciences or health innovation, and they're calling it the Innovation Arena. This is in downtown Kitchener, where it's about 100,000 square feet. They're going to have Velocity, their incubator, part of it. It's going to be space for startups and scale-ups, and it's something that they're in process of getting funding for from the province and the feds are working on that. But the intention is to make a go of this. And they're working with the city of Kitchener in doing that. And this is going to be shared development labs, manufacturing, collaborative space. So it's something we're pretty excited about. And then, of course, the new president of the University of Waterloo comes from the University of Toronto, comes from a life sciences background. So this is very much something that is a focus going forward. And it's pretty exciting for all of us. So in talking to the team here, we were talking about, what is this ecosystem's value proposition? And this is what I tell other companies. And what are we known for? And we truly are known for talent. We have the highest concentration of math and computer science in the world when you look at it coming from a university. You have a talent pool that is super loyal in tech. For 3.5 to 5 years to stay at a company. This is very unusual. It's a very relational community. As you know, everybody knows each other, right? And we like to solve hard problems. So this is a very unique talent pool that is workforce ready. So we have a pipeline coming out of the university that is massive in tech. It's the largest in Canada. And quite honestly, it produces more engineers than, Caltech or Stanford, MIT does on their own. Almost double of some of them, right? Actually very close to double of some of what they produce. So the talent is really plentiful, but it's not only there, it's the Conestoga College and Laurier that a lot of companies recruit from. We're actually doing tomorrow a lunch and learn for the cybersecurity sector about shining a spotlight on the college because they're underutilized and there really is a huge opportunity to recruit that talent and work with them. So when we talk to companies, they're recruiting from all sources, and which is about 80,000 students in this community. And now, especially during the pandemic, there's more opportunities to hire that talent because of diminished opportunities for them in other areas. But this is something that increasingly becomes our key. It's our key value proposition. And not only do we have the talent, but we're attracting it. In the last 5 years, CB Richard Ellis had done a study and identified we attracted 50,000 people. So over 10% growth every year in this region, to this region. And, and as you can imagine, the lifestyle costs had much to do with it, aside from job opportunities, but really the lifestyle costs, yet being close to Toronto. Now with the pandemic, everybody knows about the real estate prices, where that's going, and it's increasing, right? So this community is very much one that's, growing. The ecosystem, incredibly attractive to grow your company. It's one in which it's easy to navigate, 15 minutes, to actually drive through major nodes of where you want to get to. Everybody knows each other. And an ecosystem that's really small enough, that has its own tech community and culture, that, it's so easy to raise your profile, right? And attract talent and connect with others versus being in a very large metropolitan where you're a small fish in a big ocean. Of course, the value, if you look at other communities, I can say, because I know tech really well, is quite much the same as far as the cost of talent specifically, in comparison to Toronto. But at the end of the day, as I mentioned, the retention rates of your employees is much better here. And of course, the cost of real estate is much less here. So the value, and when you look at other international markets, is quite significant. Like if you're ever exploring or wondering why companies from New York or California or elsewhere are coming here, it's because it's half the cost of the talent, right? But it's really the value. The value here is what's really good, and the opportunities are here. And then location, I've already mentioned, being close to Toronto, which is important for us. And of course, in life sciences, right? We're right in the middle of keynotes like London, Hamilton, and Toronto. So our location is really quite strategic on getting to other places that matter in the sector. But of course, traveling abroad is quite easy, and it's quite quick. So I've already alluded to the other sectors, but I really want to touch this on a little bit more. If you're not aware, like advanced manufacturing is our #1 employer in this region. You know, we used to be the button capital, the shoe capital, the rug, you know, rugs and tires, etc. And, you know, with Toyota and that whole automotive supply chain, it really is a huge employer for us, along with robotics and automation. In fact, this region has the largest cluster of robotics and automation in North America. And so, as I've mentioned, we had companies in automotive looking for health innovations for their cars. So interesting opportunities it could present for you. And then business, financial services, and tech, those two in itself employ almost the equal amounts of people in those two industries. And it's about 30,000 people each in each of those industries. On the business financial services side, insurance is really large here. You've got 30 insurance offices here, 10 of which are headquartered here, including the Canadian offices for Manulife and Sun Life Clerica being the bigger ones. And they're very much, you know, and the elements of what they do are focused in health as well. And on the tech side, I think I don't need to elaborate on that too much. We all hear about it all the time, but a very important sector. And then food processing as well. In fact, food processing is almost as big in terms of employment as automotive in Ontario. So, but in this area, it's quite large as well. And then you have the underlying clusters like AI, Industry 4.0, medtech that do span across all of these major industries, right? Quantum and security. So I just thought I'd share with you very quickly the other cluster maps, if you're not aware of them. And what I'm going to do is I'll send to the team here a portal of information that this presentation, but other resources about the AI sector and all these other sectors, because if you're interested in them and you want to learn more, you can take a deeper dive and you can contact me and I can help you navigate that as well. But a very large sector that we have here, over 130 companies, it keeps growing, and some pretty big players. Cybersecurity as well. This is a little bit outdated. There's actually about, I think about 50 or 60 companies, including McAfee should be on here, and so worthwhile noting. Auto tech, of course, we have a large group here, and hopefully some more announcements to come. And then robotics and automation. This is one of our most recent cluster maps that have come out. And as you've seen on our cluster map, there's a team or a group of companies from this area that are also playing in life sciences, and then financial services. So I'm going to pause there and just talk about how we can help you specifically. All right. So overall, when we talk to companies, the #1 thing that they're interested in is often talent, because we're growing. And so we've put together resources, and just through talking to them, I can find out, what have you tapped into? Have you tapped into college, the schools? Did you know that the college has not only their typical job fairs that they partner with Laurier, Guelph, University of Guelph and UW, and it's largest in Canada, but they even do other recruiting events on the side through Facebook, like in unusual ways. So it's really interesting when you just get to know those opportunities. We work with recruiters. We promote it through our own networks. If you have announcements that are big, we'd love to hear them and promote them, because it promotes what's happening in this region. Often we have companies too that are expanding, that are looking for funding. So they're looking to navigate what programs are available, what's the best one for them. Sometimes they're going to new markets. So as we're in the US, I go to New York and Boston a lot, and California, not these days, virtually, but we have the relationships. And we're also going to Germany and UK. But we're very closely connected to the Canadian consulates, the trade commissioners. So it's all about relationships. It's helping each other out, and it's a small world. And then finally, I love it when we talk to some companies, and they're looking for partners. They're looking for suppliers. They're looking to innovate. They're looking to invest in companies. So we've had some business transactions that have come about. For example, Darwin AI has worked with Honeywell. They've worked with, I believe it was VW. We've talked to them. So we've made those connections even for Icera, a few other companies. So Novacol, we helped recently get some money from, that was from SWATF. No, sorry, SWATF, I believe. I crossed my lines. That was a large announcement, and we've helped here on digital pathology as well with funding. So anyhow, these are some ways that we've helped. On talent, business immigration. Sometimes people are looking to bring in talent from other locations they have around the world, or new talent they want to bring in. So we help out with that. But all in all, we're connectors. So connecting into the ecosystem, just staying abreast of what's happening. And often we find, more often than not, people just don't know enough about what's happening locally. So if you are growing and you're looking to find out more, by all means, reach out, and I'm happy to have a conversation.
Catherine, thank you so much. By the sounds of it, I think we all ought to be having probably more communication with Waterloo Economic Development, your team. I mean, one of the things that I would say, and actually one of the things that attracted me to Waterloo Economic Development in the first place, was your blog. I think that the Waterloo Economic Development blog actually is probably one of the most credible sources and well written in terms of what is happening in health and tech and kind of many of the ecosystems that you've talked about. So if you've never looked at the Waterloo Economic Development blog, then I suggest that you follow it because the content is excellent. June, do we have questions from anyone at this point?
None are in yet, so I encourage people to please post in your questions. Otherwise, John, do you have some questions you want to maybe get things started? People will feel more comfortable.
Well, actually, I was going to invite maybe Zach Weston and others on this call if they are able to unmute themselves and maybe comment. Obviously, we'll hear from Elliot in just a second as well. But I know that there are a number of people here. Zach, you have known many people in this region for a long time.
Yeah, thanks, John. Good to see so many familiar faces, and great job, I would say, on the map that was created. When I was first looking at it and just going through and counting the number of companies that I had the privilege, I think, to have an opportunity to do some consulting and mentoring for, it was very impressive to see that they all showed up on the list in one form or another. So, I certainly don't know, or didn't know the ecosystem to the degree or the extent that obviously the team put all that time and effort into creating it. So I would say that I'm very impressed with the work that was crafted there. So, I think that, clearly this is a special community when it comes to medtech innovation, and there's been, a number of folks, who have been in this sector for quite some time. Elliot certainly being one of them. Armin Bakurtsian at IntelliJoint and the Mix. But our institutions, our post-secondary institutions, certainly have created an environment that, in my opinion anyway, from my experience at Laurier and brief time at Conestoga and also at Waterloo in different capacities, really has that spirit, I think, of fostering a different approach than other communities where, they're really medical school driven. And we've come about it in a different way. And I think it's a really important difference. And because of the strength of our, the background that we have, and, whether that's our, barn raising type of mentality, to come together in an engineering type of model, it really has paved the way for things to accelerate here in an exciting way. And when you bring in engineers and other folks with ideas and the know-how to create and make things that can support the clinicians to provide outstanding clinical care. Those are the things that are exciting to me that we can spread across the country. You know, one of the things that I'm quite proud of in my role at Laurier, where I teach entrepreneurship for science students, a number of years ago, the Dean of Science came to me and said, you know, we need to create a space where students can learn how to make things themselves. Far too often, our university students spend so much time in textbooks and they don't actually develop any skills. And ironically, he asked me if I had the ability to take that on at the time and teach people how to use 3D printers and laser cutters and all this sort of thing. I said, I don't know the first thing about any of that stuff, other than they're really cool technologies and important things that people should know how to do, that, you know, and use. But I did take the time to champion that idea and identify, you know, the right engineering background individual who could take that and run with it. And I've integrated that into my entrepreneurship courses at Laurier. It's not a requirement, but it's a bonus opportunity that the majority of my students take part in, to learn how to use all of those tools, so that, you know, we're equipping those students that have a science background, most often in healthcare. Now they can tinker away. You know, they can take their ideas and they can kind of test them, make their own prototypes and MVPs on their own, and then get some feedback from mentors who can then take them to that next step. And you know, that's what I see as exciting. And again, back to, you know, why we're all here tonight, the roadmap that you know, it brought us together. I think it's really nicely articulated and described you know, visual that helps us to, you know, see the various players and the specific aspect of medtech or health tech, where they fall within the community.
Thank you, Zach, as always. Catherine, did you want to comment before I invite Elliot?
I just think we're really blessed, that's all. I mean, I came to this community from Niagara, and you know, and I know how other communities operate, and this community's always been a place about ideas and collaboration and paying it forward. And we're really lucky, whether we realize it or not. So it's no surprise that it's just continued to, you know, to grow. But I'm just really excited about the, you know, innovation arena, for example, and the focus of UW taking towards life sciences, and you know, I think we've got something special here.
Yeah, thank you, Catherine. Yeah, I couldn't agree more. I mean, I think that we have always been a hotbed of innovation and startups. I think, yeah, probably 3 years ago, I think we felt that maybe there was a gap for then that sort of scale up kind of stage. Intellijoint Surgical, Armand Burkertzian, as we've mentioned, was kind of blazing that trail, and I think through that and probably his experience, we saw MIX, Medical Innovation Xchange, which provides a wonderful segue to invite Elliot to expand on that. And yeah, I mean, I know that Elliot, Armand, and others were either advocates or drivers behind the development or the desire to see that health innovation ecosystem map. Elliot?
Well, thanks, John. So it's great to see everyone, and I'll echo Zach's comments that, you know, it's really nice to see some familiar faces. Zach and I actually used to be on the same team over at Ontario Health, and I haven't seen him for a little bit of time because of the pandemic. So nice to see you, Zach. I'm sorry that you're wearing that sweater, but go Vegas. Sorry, he's wearing a Habs sweater. I had to get a dig in there.
I wasn't expecting to
Too late now,
tonight, so I might have dressed differently. Sorry, if I was ready.
Well,
should know me better.
That's okay. You know, just to build on the excellent work that was done around that the ecosystem map. You know, we have a growing and robust opportunity around medtech and developing this ecosystem in Waterloo region, in spite of the fact that we don't have an academic hospital, in spite of the fact we don't have a medical school. But what we do have in Waterloo region are everything else that we need. And I actually don't advocate that we need those two things in this region. We have everything else. We have all of the tools and the resources that we need to really establish this region as an international hub for medtech. And that's part of the goal of MIX. So MIX was established a couple years ago, technically a couple years ago, to solve two problems. One was to promote and accelerate the growth of Canadian or domestic medical technology companies, health innovation companies, but help them grow not only within the Canadian border, but outside of Canada and international markets, with the big caveat that we want to see them retain their headquarters here in Canada. So, all too often we've seen amazing companies be developed out of UW, out of other academic institutions. And then just because the medtech climate is so different compared to growing other types of companies, those companies sometimes went down to the States to participate in different incubators. They'd have investment opportunities, and they'd either get acquired or they wouldn't come back for all sorts of very good reasons. So MIX was set out to solve that problem. The second problem that we set out to solve is really getting Canadian medtech in the hands of clinicians and in the hands of patients. There's some incredible medical and health technology that exists right across this country that can solve all sorts of problems for our clinicians and our patients. But unfortunately, because of all sorts of regulatory barriers, systemic challenges, and international competition, we never see those technologies being used for Canadians. So MIX set out to solve those two problems. We are growing quite rapidly. We occupy about 31,000 square feet of space right now in Kitchener. We're almost full in terms of our existing footprint. We have 6 resident companies with us right now. So companies take a residency for at least 2 years because that's really where we see the sweet spot for scale. And we help them overcome those typical scaling barriers. So when a company has either outgrown or graduated from other incubator programs, like Velocity, for instance, who's a integral partner of ours, when they get to that scale up phase, that's where MIX can come in and help them. So we've got across all 6 companies somewhere around 150 full-time employees at our Kitchener location, not part of MIX, but part of those 6 medtech companies. 4 of them were born out of biomedical engineering program projects at the University of Waterloo. So, as Catherine mentioned, the strength of our academic institutions is incredibly beneficial to our ecosystem. The other problem that we're here to help with, though, is if you take a look at that ecosystem map, there's only a handful of companies that are on there that are homegrown and have retained entire Canadian ownership and are still headquartered in Canada. There's some really big companies that are great companies, but there's not a lot of Canadian companies that have grown and managed to be able to stay here and grow at the same time. Effectively. So what we do is we bring those companies together, companies like IntelliJoint, Nicoya, K Imaging, those types of companies. And many of them offer and provide mentorship and advisory services to our smaller scaling companies that are working with us. So, if we were to redo this map in 5-10 years, we hope to see a lot more of those companies on the map, and really establish Canada as an international destination for medtech. So when people think of places to go in the world for medtech, when they think of Dubai or Boston or Austin, Texas, we want them to think of Canada, if not Waterloo region. So this is a great opportunity, I think, to really expand on that work, and looking forward to working with everyone.
Elliot, thank you, and yeah, we thoroughly admire the work of MIX in accelerating, pardon the pun, health tech in the region. So questions from anyone? I mean, there's a small enough group of us that if you wish, you can unmute yourself and ask a question, either of Catherine or Elliot or anybody else.
Yeah, I have a quick question.
Go ahead, Denny.
For Catherine, like, do you only focus on medtech, or you also do all the other little community that you show?
Yeah. So we have a team, so of 5 working in business development, and so we work in all those other sectors. So I do 2 things. So I wear the hat of attracting companies here, and that's across all those sectors. But locally, where I'm more responsible for a sector, it's on the cybersecurity, business financial services, and life, and basically the health innovation.
Okay, thank you. And I'm curious question for Elliot about how you help bring exposure to practitioner. Can you elaborate on that a little bit?
Yeah, so it's an interesting question because the companies that we work with that are in the scaling phase would typically come to us with a robust group of practitioners, like clinicians, advisors, things like that. But we do have a network that we curate. So when there's opportunities for collaboration or even questions, we've been able to introduce different clinicians and surgeons and practitioners to some of our mixed residents who may be looking to do either clinical trials or even just informal surveys. So the trick is finding the right people. And I think everyone on here knows, especially if you've been in that seat where you're trying to develop something, you can knock on about 50 doors and maybe one door opens. We do try to make that easier by holding a curated list of people who already understand the importance of innovation and want to help. So typically, like I said, our companies would come to us already with those clinicians in their portfolio, but we certainly do help make those connections as well.
Thank you.
Thank you both. Any question from anyone else in the group? I'll give you a second. I'll give you a minute to Catherine. One of my questions actually for you was that yeah, I mean you've talked a lot about rightly so in terms of what Waterloo Economic Development is doing and how you can support the companies. Flip around. I mean, is there any way that the companies can help Waterloo Economic Development, or in terms of maybe the dissemination of this health ecosystem map?
Absolutely. Yeah, promote the map. I think it's good for everybody on that map, right? Gets the word out. That's the whole point of it. If you're growing, you know, other people are growing, we'd love to connect and talk and see if there's a way that we can help support that. Again, like we, you know, even going externally, we don't, that's not our mandate to help with international development, but we have connections, right, through the consulates or the trade commissioners, because we go to those markets. So we're happy to chat and see where we can plug you into those resources. Sometimes we go to conferences, they're looking for speakers, right? We always try and find local companies that we can promote to talk about their technology, right? And by virtue of them talking, they're talking about Canada and Waterloo, that's where they're from. So overall, just if you're growing and you know, you hear of others growing, come talk to us.
So just a quick last question then. Other conference experience in the past, like say like SPIE and like some conference far away across the continent in Silicon Valley or in Germany, another sector. US trade mission that has been organized to essentially reduce the cost of boots to go to those places? Like, is it the kind of stuff you do a lot, or
No,
not
it's
you?
not. No, not our organization, but the province does. Sometimes the Canadian consulate does as well, and we know about it. So we often go to, we're very selective on when we were going to conferences, which ones we went to. We go to the ones that the province or the feds are at as well, so we can piggyback off of and pool together our resources. And there's always a focus for them to help Canadian companies, which is great. So wherever we can plug companies into those opportunities, we'll do that. Oh, and then last, go ahead.
So Silicon Valley SPIE for the photonics, for example, big. I'm gonna on my own go there, find the boots. A lot of company I know from around here were there, but again, I know that this event is going on. I get a bloody email, and I don't have enough people watching all those emails. I guess that's the problem. But so you miss the boat sometimes. So I was wondering if this map is kind of used for, like, for example, if you go to a photonic device, you will essentially either read with California to get half price. I mean, you have, it's be too popular, right? So you kind of select who you want to come along, kind of thing, right? I'm
You
saying,
broke up
like,
just
if
a
you
little
do
bit, but I think.
So essentially, when you go to, you don't do mission, you don't do that.
No.
You EDC,
No.
and the Waterloo EDC is the EDC, the Waterloo branch, right? It's not a separate company.
Sorry, you broke up just a little bit. So Waterloo, so although it says Waterloo EDC, by the way, it's Waterloo Region Economic Development Corporation. I should just clarify that. We're not for profit. We're not, we get our funding from all levels of government, including the feds and province. So we're completely not for profit. So our mandate is purely investment promotion, promote the region, to bring companies here or invest in this community and help our local companies also grow. It's all about creating jobs. And so when it comes to
okay,
those,
because there is the organization, is the BD, the EDC, and the EC subgroup.
sorry, you're breaking up a little bit, but I think you're saying that Waterloo EDC is confused with Export Development Canada. Is that right? EDC?
That's my question. Second,
yeah, you were not EDC.
Okay, good.
Yeah, thank you, Catherine. Sorry, Denny, your headphones were breaking up a little bit. I think there was a question also from Chris. Catherine, you had mentioned earlier about some of the big companies in the automotive community looking at healthcare. Did we hear that correctly? Can you elaborate on kind of what is the interest without giving anything away confidentially?
That's right. Yeah. It was about a couple of years ago, for example, where that was quite popular with autonomous vehicles and, what's the newest innovations. And they were looking at things that, how to detect how the driver's doing in terms of health condition, right? So that was one of the things they were asking about. And so we didn't have the comprehensive list that we have now. And so this is a very helpful tool for us. It's not something that we are resourced to do this matchmaking because it's not in our mandate, but on the, it's good to know wherever we know what people are doing, we'll make the connection.
That's great. Thank you, Catherine. We've got about a few minutes left. Elliot, any final comments or remarks on what you've heard this evening?
No, I don't think so, John. But we're happy to help wherever we can as well. We're also not for profit, so we just want to see, really good success in the companies in Waterloo region. So if you think you're a good fit for Mix as a resident company or otherwise, just go to our website and there's a form you can fill out or reach out to me and we can go from there.
That's great. Catherine, any final comment?
I'll follow up through you guys, a portal of information just so people can take away. And by all means, if I can help navigate or connect in the ecosystem, let me know.
Fantastic. June, anything that we have forgotten?
No, I think everything was covered. Yeah, the thing I find fascinating is hearing about all these different companies and the ones who have like where they've got their global research hub is here, and hearing all those connections that are happening. I find that really fascinating. So thank you very much.
Anyway, we did this Hacking Health Cafe because we just think that this is just such a wonderful initiative. So thank you again to Catharine and Elliot for being tonight's guest speakers. You can find the link to the Health Innovation Ecosystem map in this chat. We will also share it with you afterwards. Thank you, June, McDonald, for organising tonight's cafe. Now, our next cafe will be in the fall, and you will receive notification through Meetup. So until then, stay safe and enjoy the summer. Thank you all so much indeed. Bye for now.
Thank you.
Good night, everyone. Bye.